Hi, Dr. Scott Abrams here. It is the height of viral respiratory season. Urgent care times and ER times are apparently quite long, and so we're going to talk about viral respiratory illnesses today. Hopefully this will be a lot of information you probably know, but maybe we can provide you with some new information that might save you a visit from coming and sitting in a busy urgent care waiting room with a lot of other sick patients. Let's just talk about viral respiratory illnesses in general first. Again, a viral respiratory illness usually lasts 1 to 2 weeks. So viral respiratory illness means I have a cold, a cough, something like that. And the usual progression of a respiratory illness is nasal congestion, sore throat the first few days, and then a cough later into it. So you might not cough till that second week. And this is often when we see patients say, oh, I had a cold, but then it went into my chest. And they really come in with this expectation that that requires treatment. And it is still part of the same viral respiratory illness and doesn't require any treatment. So that can lead to some frustration. Sometimes people come in, they wait a long time, and you tell me it's just a virus. Well, that's because it is. Bronchitis, is a viral respiratory illness that just requires ibuprofen, Tylenol, maybe some over-the-counter cough medications. Fever is very common during the first few days of an illness and not necessarily a cause for panic. It's a body's natural response to an infection. So even a temp of 104 in kids is really common. And the question isn't how high is the number, it's what does the child look like. And so if your child has a fever and they're uncomfortable, and you don't have to treat the number, treat the discomfort. If your child's uncomfortable, they look like they're sick, ibuprofen or Tylenol. Ibuprofen for kids over age 6 months, by the way. So ibuprofen or Tylenol, if they perk up and they feel better after giving an anti-fever medication, then great. It's just a cold and a fever, and that's pretty common. In urgent care, we don't always test for specific viruses because it doesn't necessarily change the outcome. Let's talk for a second about when a fever, when it is concerning. I think a lot of times we talk about the child that looks toxic, and this is the wet noodle or the kid that's just lethargic or short of breath, the kid that looks terrible. Again, they look terrible when they're running a high fever. Every kid does. But you give them ibuprofen, do they perk up? Do they look better? They're not short of breath. They're running around. They're eating. They're drinking. That kid, of course, is doing fine. But the kid with a high fever that looks terrible and doesn't respond to ibuprofen or Tylenol, that's when we get more concerned. What's behind the fever? That's really the question. And if it's just a cough and cold, it can stay home. The child can stay home. Let's talk a second about antibiotics. So this is the season for influenza, COVID, RSV. These are all viral illnesses and don't respond to antibiotics. Now, we've all had that cold that went away in 3 to 5 days, and I wish that were the case all the time. But in urgent care, we frequently see that person that I've had this cold for a week and I just can't shake it. I know it's time for antibiotics, doc. And of course, that's not the case. Viral illnesses normally aren't gone in 3 to 5 days. They're 1 to 2 weeks. And so in general, it takes up to 2 weeks for that viral illness to go away or to turn bacterial. And if your illness has gone on longer than that, that 2 weeks time, or you're getting worse in that second week, fever, shortness of breath, getting worse, that's when you should be concerned. When do you come to urgent care? If it's gone on, nearing that 2 weeks, if you're getting worse instead of better. So at any time, of course, if you're short of breath, vomiting, can't keep fluids down, that kind of thing, then we should see you. Influenza is a viral respiratory illness transferred easily person to person, and the hallmark of it is its abrupt onset. You got hit by a train. Everybody says this. They got fever, chills, body aches, headache, sore throat, runny nose, cough. The worst symptoms usually last 3 to 5 days. The cough can last up to a week or two, so don't be shocked again if that cough goes on longer, but it's that worst 3 to 5 days, which is when you're highly contagious to other people and should stay home. When should you be concerned? If you're short of breath, can't keep fluids down, and not just one episode of vomiting, of course, but I can't keep fluids down for a day or two. RSV for most of us is just a common cold. In adults, it's a runny nose, maybe a cough. We worry about RSV in young kids because the hallmark of RSV is mucus. You get so much drainage, and these kids get mucus plugging in their small airways, which causes the characteristic wheezing that kids get. And the younger the child, the more at risk they are, of course. A vast majority of children get RSV, and it's just a cold and you don't know it. Again, treat with Tylenol, ibuprofen for discomfort or fever, and then we need to know about it when they're short of breath, when they have difficulty breathing. RSV, the shortness of breath or the wheezing, usually peaks at about 3 to 5 days. And every parent wonders, how will I know when my kid is in trouble? And you'll know. They're short of breath. They're breathing fast. You can see their ribs, the skin between their ribs sucking in. You can see their stomach sucking in. They look like they're struggling. And we need to see them when they're working hard at breathing. COVID-19. So we all know more about COVID-19 than we want to, but we are seeing a lot of COVID-19 along with influenza and RSV. The more recent variants are less severe, but it still does cause severe illness in certain populations, and that's really what we need to know. If you're a young, healthy person who has no complications, you don't have asthma, you don't have diabetes, this is going to be a common cold for you, and the odds are that you'll cruise right through it and don't require any treatment. So I love at-home test kits. If I want to know if I have COVID-19 in my house, the at-home test kit is a great idea. If you have discomfort, fever, you can use Tylenol or ibuprofen. You can use over-the-counter cough medications for cold. Those considered at risk are those who are the elderly, the overweight, those with diabetes, and those that are immunocompromised or have lung disease, asthma, or COPD. So if I have COVID-19 and I know it, I can just stay home for the 5 days. I don't have to be seen in urgent care for that. But if you have shortness of breath or you have risk factors, the sooner we diagnose it, there are treatments that are available for those populations. Hopefully that gave you some information about viral respiratory illnesses, when to come to urgent care, when we don't need to see, and you can just stay at home and be treated. If you don't know, you can always try a virtual visit. As always, during the viral respiratory season, stay safe, keep yourself safe, wash your hands, cover your cough, and when you're in that most contagious phase, that first 3 to 5 days when you feel terrible, when you're running a fever, stay home from the office, keep the kids home from school. This is the holiday season when we spread viruses like crazy because we need to be with friends and family. So stay home, stay safe, and have a happy holidays.